Hello, and welcome to this industry-presented webinar, Promoting the Physical Activity Guidelines. A few housekeeping announcements before we get started. After viewing this presentation, you will have the opportunity to take a short survey where you can also post a question for the presenters and complete a 15-question self-test for your CEC. Upon successfully passing the self-test, you will receive a CEC certificate via email awarding your CEC, and your CEC will automatically be added to your ACSM profile. Today's webinar is presented by EXOS and Google Fit. EXOS is a leader in proactive health and performance, working with everyone from office employees to pro athletes, students to military personnel. EXOS helps people perform at a high level so they can achieve what matters most to them. The Google Fit app, available on Android and iOS, is designed to coach people to a healthier, more active lifestyle. It helps users set and achieve activity goals based on recommendations from the World Health Organization and the American Heart Association. Users can track progress using their phone and sync data from wearable devices. Today's webinar presenters are Tristan Rice and Dr. Kapil Parakh. Tristan Rice has worked with EXOS since 2008. During his time with EXOS, he has worked with athletes of myriad sports and various levels, including Olympic, professional, amateur, recreational, and youth athletes, in addition to over 5 years of work with the general population. Tristan began his involvement with the education department in the spring of 2011 and went to the education team full-time in the winter of 2015. He has taught in over a dozen countries on 6 continents. Tristan studied kinesiology with an emphasis in exercise science at California State University, Northridge. Dr. Kapil Parakh is a practicing cardiologist who serves as the medical leader for Google Fit. He helped lead the redesign of the app, working with the World Health Organization and the American Heart Association to incorporate their scientific recommendations into the product. Before joining Google, Kapil was a White House Fellow and served as the Principal Health Advisor to the Secretary of Veterans Affairs. He is also the co-founder of an award-winning nonprofit on health innovation. He was previously Director of Heart Failure at Johns Hopkins Bayview, where he developed novel care delivery models. As a clinician scientist, he has published over 35 papers, many on psychosocial factors in heart disease. Kapil is board certified in internal medicine, cardiology, and advanced heart failure, and holds an MD, MPH, and PhD. It is with great pleasure that we present to you Tristan Rice and Dr. Kapil Parakh.
Hi, everybody. My name is Kapil Parakh, and I'm really excited that you can join us today. I'd like to take some time walking you through some of the science behind physical activity, much of which you'll already be familiar with, but hopefully we can help you think about this in a different way. And I'm collaborating on this with my colleague Tristan from EXOS, who will give you some practical tips on how to implement some of this information that we present. So just to get started, some basics about the webinar. This webinar is co-sponsored by Google and EXOS. There is continuing education credit, and this will be provided by ACSM. As I mentioned, the presenters are myself. I'm a cardiologist and the medical lead at Google Fit. And then Tristan Rice, who's a performance specialist at EXOS. And as I mentioned, he can give you some fantastic practical tips as we get into this. The objectives of this webinar are to reframe the importance of physical activity and its benefits to our clients, to learn the key recommendations for physical activity guidelines and make them actionable, and to explain the options to measure the intensity of physical activity, and then to design novel programming for your clients using heart points as a guiding metric. So many of you will know that chronic disease and inactivity are linked. Worldwide, chronic disease is the leading cause of death. In fact, it's so prevalent that if you take all the infectious diseases such as malaria, tuberculosis, diarrhea, pneumonia, etc., chronic disease accounts for more deaths than all of those combined, which is quite dramatic. Aside from the effect on mortality, the challenge with chronic disease is that it results in a poor quality of life. So you can imagine somebody who's had a stroke they might not have died from their stroke, but the quality of life after that stroke is significantly reduced. Now, we all know that physical activity can have a tremendous impact on reducing the burden of chronic disease. And even when you have chronic disease, it can reduce the impact of that disease on your life. And unfortunately, even before COVID, the world was getting less and less active. And now with COVID-19, there is an even greater physical inactivity in the population. So there's really an opportunity to help people as they think about getting more active. Just a quick review of chronic disease in America. About 50% of all Americans are living with chronic conditions, and that's quite dramatic. Most of these chronic conditions are cardiovascular, heart attacks, stroke, peripheral vascular disease, and so on are the main culprits. But then there are others. 108 million Americans have hypertension. 34 million Americans have diabetes. That's a lot of people. Some people would classify obesity as a type of chronic illness, and 70% of US adults are overweight or obese. And unfortunately, many Americans have more than one condition, as a lot of these are interrelated and linked. Now, the evidence underlying physical activity, many of us know that physical activity is good for health, but if you start looking at the scientific studies and trying to understand, how do we know that? There are a couple of different types of studies that inform this evidence base. One type of study is essentially what we call a large-scale association study. You look at a large group of people, tens of hundreds of thousands of people, and you see what the rates of disease and mortality are in the people who are more physically active and compare that to the people who are less physically active. And what these studies consistently show is that people who have higher levels of physical activity have lower morbidity and lower mortality, which is important. Now, sometimes the criticism against this is that this is an association, and correlation doesn't necessarily mean causation. So there's another source of evidence, which is intervention studies. So these are typically smaller studies, and in this case, we look at a surrogate outcome like blood pressure or cholesterol or blood sugar, et cetera. And this is a surrogate because it's an in-between measure between, the intervention, which is increasing physical activity, and the ultimate thing you want to do, which is reduce mortality. We haven't been able to do these studies at a large enough scale over a large enough period of time to show that a physical activity intervention can reduce mortality. But we have been able to show that physical activity interventions result in better cardiorespiratory fitness, lower blood pressure, lower blood sugar, improved HDL cholesterol, which is the good cholesterol, and so on. And all of these are directionally suggestive that the association that we saw in the large-scale association studies is actually not just correlation, but causation. And these studies go back several decades and are pretty much consistent that physical activity is associated with improved health. Once you think about that concept, that physical activity is good for health, then the next thing that comes up is, well, how much physical activity do we need to improve health? Now, I'd like to be clear that this is different from an athlete that's trying to improve their performance or something like that, in which case the physical activity is really geared much more around performance. This idea of how much physical activity we need for health is really purely focused on the health benefits of physical activity. So before 2008, there were variations in the recommendations from many organizations around the country and, in fact, around the world. So organizations like the ACSM, the American Heart Association, and so on, had slightly different recommendations. In 2008, the first US federal physical activity guidelines were created, where everyone sort of came together and agreed upon a single recommendation, or a not single, but a cohesive recommendation, a consensus recommendation. This led to the WHO sort of building upon that and releasing global recommendations for pretty much the whole world, and that came out in 2010. The US physical activity guidelines were updated in 2018, and the WHO recommendations and the process of being updated. The scientific report that underlies the US guidelines is 779 pages long, and that's a lot of virtual ink to be spilled to explain the importance of physical activity and how to measure it. But if you're interested, here is a link that's to the full report, and you can certainly look at those. Part of this talk is to try and summarize this nuanced guideline into something that's a little bit more actionable in your work. Now, this report summarizes the evidence base, some of the studies that I mentioned in the previous slide, and it provides overall recommendations for the amount of physical activity and how to measure it. It is really focused on the average adults, sort of 18 to 64. It doesn't apply to children or people who are in the senior category, or those who have chronic conditions, et cetera. For those, they may be different recommendations and maybe tweaked by the physician taking care of the patient. Now, while this is a fairly comprehensive report, we also understand that some of the science is still evolving. So for example, something called bout length is a concept that has evolved over time. In the past, it was thought that you needed at least 10 minutes of activity for it to count towards cardiovascular or health benefits. Now, the understanding is much more that every little bit counts, and it's not necessary to focus on the bout length. Similarly, there's evolving science around step counts and how many steps are associated with health, and vis-a-vis step rate, which is more of a measure of intensity, and that may have a different implication of what's important for health benefits. And there's still research going on around whether it's important to reduce total sedentary time, your time that you sit, or is it just important to break up big chunks of sedentary time into smaller chunks? So should we be standing up every hour, for example, or should we just try and have some standing, even if it's at the end of the day, and it doesn't really matter how you time that? These are research questions that still haven't been fully answered. If I could summarize those 779 pages into a few phrases, the two key recommendations are to increase light activity and to try to get 150 minutes of moderate to vigorous physical activity, or MVPA, every week. So increasing light activity and trying to get 150 minutes a week of moderate to vigorous physical activity are pretty much the two main recommendations that come out of it. And why are these two important? And more importantly, why are they separately important? As in, is it important to do, it's important to do both. Even if you achieve one, you should still try and achieve the other one too. This graph really explains that relationship between moderate to vigorous physical activity as well as the sedentary time or sitting time. So on the y-axis, which is, if I may just get a pointer up, I can demonstrate this better. So on the y-axis is the daily sitting time. This is how much time somebody spent sitting in a day. And on the x-axis is your moderate to vigorous physical activity, or MVPA. And what you see is that this graph is color-coded so that the red is the highest mortality, where somebody has a lot of daily sitting time and not very much moderate to vigorous physical activity. As your moderate to vigorous physical activity increases, your mortality rate gets lower, but really to get the most benefit, you should reduce your total daily sitting time as well as increase your moderate to vigorous physical activity, and hence the dual recommendation of reducing sitting time and achieving that minimum of 150 minutes a week of moderate to vigorous physical activity. This data comes from a meta-analysis of other studies, and so taken together, this meta-analysis included about 1 million people, which is a pretty large sample. You could simplify these recommendations even further to just a few words. Move often, huff and puff sometimes. Move often meaning reduce sitting time, huff and puff sometimes meaning get your moderate to vigorous physical activity. So let's dig into this a little bit further. What is MVPA, or moderate to vigorous physical activity? There are two main ways to measure the intensity of physical activity and to determine whether it is light, moderate, or vigorous. The first way to measure this is something called absolute intensity. Now, absolute intensity is the rate of energy expenditure to do an activity. So for example, if you're 150 pounds and you're running at 6 miles an hour, there's a fixed amount of energy that's required to do that task. That is often measured in a unit called METs, which is also metabolic equivalence. And 3 to 6 METs is often considered moderate intensity. This could be like a brisk walk, for example. And greater than 6 METs is considered vigorous intensity. Now, we also know that the intensity, the absolute intensity, just measures the amount of work, but that exercise feels different to different people. This is captured by something called relative intensity. Relative intensity is an individual's cardiovascular response to exertion. So different people have a different response based on many factors, such as fitness level, age, etc. As an example, I have a friend who's an elite runner, and he does marathons and has been doing them for many years. For him, you know, a 5K is something where he would barely break out a sweat, whereas for somebody who's sedentary, doing even 5 or 10 minutes of running would be very vigorous and a relatively high relative intensity for them. Now, relative intensity is often expressed as a percentage of maximum heart rate. So, for example, moderate intensity is 50 to 69% of your max predicted heart rate, and vigorous intensity is greater than 70% of your max predicted heart rate. And there are a few different formulas for max predicted heart rate. The common one that you might have seen is 220 minus age. And then there are also other ways to think about the moderate intensity or vigorous intensity from heart rate, for example, using heart rate reserve and including the resting heart rate in there. Regardless of how you measure it, whether it's perceived exertion or heart rate-based measures, relative intensity is really all about how an individual responds to exertion rather than the absolute amount of exertion that they're doing. This begs the question, which is better to calculate MVPA? The guidelines say either one works. Either one is acceptable. Whatever you have available is okay. That said, relative intensity is a little bit more personalized compared to absolute. So when working with your clients, it may make more sense to focus on relative intensity so that they have a more personalized experience. Now, one of the challenges with this guideline recommendation that either one is acceptable is that different measures can result from different devices. If you happen to take a jog or a walk every day with a heart rate-based device like a smartwatch that's measuring your relative exertion over that period of time, you could repeat that exact same walk the next day or run or whatever with a phone, and the phone might just measure your step rate, which is an absolute measure of intensity, and the two may return different categories of moderate versus vigorous because they're measured in different ways. That's just something to keep in mind when working with your clients, that there may be a subtle difference in those numbers and that they shouldn't be alarmed by the difference, but rather to understand where it comes from and how to use those numbers. So what exactly is 150 minutes a week of moderate to vigorous physical activity? The specific recommendation is 75 minutes a week of vigorous intensity or 150 minutes per week of moderate intensity, or a combination of the above. And you can look back at an average week and do a little math and figure it out. However, most people are not very good at doing math and calculating how much of their time was in vigorous, how much time of their time was in moderate, etc. This can lead to frustration in consumers because this is a fairly complicated construct. They are also exposed to messages in the media and from friends, etc., about things like steps, 10,000 steps, that is not in the guidelines. They may be worried that they don't have access to a gym, they don't have time, and of course, we're all dealing with COVID-19, and so how can they sort of get around this? I think it's important for us to use all the tools that we have available as health professionals to try and help consumers understand and demystify the health guidelines. And particularly at a time when they're interested in this, right now, for example, with COVID-19, people are much more interested in their health. And particularly over the new year, we see a lot of people interested in health as they take on New Year's resolutions and they start exercising, not for performance reasons, but for health reasons. And this is a time really that you can engage your clients on getting healthier for health reasons. Consumers are confused and overwhelmed with how to manage their health. The lack of clarity on what matters. More than 50% of US adults are not able to meet the physical activity guidelines. And if you look at the apps and products out there, a study showed that only 1 in 379 apps accurately represent and educate on the health guidelines. So as personal trainers, there is a tremendous opportunity that you can make the health guidelines understandable and achievable to your clients. Now, why is this important? If you look at the people who meet the 150 minutes of MVPA per minute, you see a significantly lower rate of disease. A 40% reduction in rates of type 2 diabetes, 35% reduction in heart disease, 25% reduction in falls, depression, and dementia, and even the rate of cancer is lower at 20% lower rates of colon and breast cancer. And it's not just the long-term benefits. In the short term, one other long-term benefit, a minute of moderate to vigorous physical activity is estimated to add at least 5 minutes to life expectancy. So these are all the long-term benefits, both preventing disease and increasing lifespan. But there are also short-term benefits. Physical activity has been known to improve mental health and resilience, which is particularly important given all the stress everyone is dealing with right now. Physical activity has been shown to improve sleep quality and duration. So these short-term benefits as well as long-term benefits of physical activity make it important to help your clients meet the physical activity guidelines. Then the question is sort of how can this be actioned upon? Tracking is the key. Something as simple as pen and paper, a smartphone, a smartwatch, chest strap, whatever you have available. If a client is able to keep track of their physical activity, then you can translate that into the guidelines and moderate vigorous physical activity and help them understand where they're at. We're going to take the example of Google Fit, but the principles of underlying the physical activity guidelines can be applied to any of these above tracking mechanisms, as simple as pen and paper or as fancy as a chest strap with an app and all the bells and whistles. So how can Google Fit help meet these two main guidelines of increased light activity over the course of the day and at least 150 minutes a week of moderate to vigorous physical activity? So there's a metric in Google Fit called Move Minutes. It's designed to reduce sedentary behavior to increase that light activity, and it gives credit for all movement and gives users a sense of accomplishment. Google Fit also tracks steps. This is particularly relevant because many people are interested in steps. And in fact, when we first launched Move Minutes and put them quite prominently in the app, people wanted their steps back. They wanted it to be easier to find their steps because users really care about this. So for those that are interested, steps are a perfectly fine way to help increase your light intensity physical activity. I think the important thing to remember is that the health benefits start well below 10,000 steps. As long as you can get those, get the clients moving, get the steps so that you reduce your total daily sitting time on that y-axis of that graph that I showed you earlier, that's the key. Whether you do it through Move Minutes or steps is less important. The important thing is just make sure people are moving throughout the day. And here you can see an example of the interface on Fit, where you can see both steps and Move Minutes available depending on what people want to focus on. Another metric that we introduced was heart points, and this is really to demystify and simplify MVPA, or moderate to vigorous physical activity. The goal is to reward users for every minute of moderate activity, they get 1 heart point, and for every minute of vigorous activity, they get 2 heart points. Therefore, if they can get to 150 heart points a week, they would have made some combination of moderate and vigorous physical activity that meets the physical activity guidelines. Now, how are heart points awarded? So if you have a phone or a smartwatch-based accelerometer, you can actually just use step rates. So 100 to 129 steps a minute, this is based on population averages, is 1 heart point per minute, which is about a brisk walk. Greater than 130 steps per minute, it is 2 heart points per minute. This is equivalent to vigorous intensity physical activity. And really what this does is it captures people who are jogging or running. And these are absolute intensity measures. If you have a phone, you can also auto-detect cycling, which is rewarded at 1 heart point per minute because most people cycle at moderate intensity physical activity levels. Now, if you have a smartwatch-based heart rate and it's capturing heart rate with activity, that's fantastic. Then it can Google Fit will use the percentage of maximum predicted heart rate to award heart points. So 1 minute at 50 to 69% of your max predicted heart rate will result in 1 heart point per minute. And if you're working at greater than 70% of the max predicted heart rate, then that's vigorous intensity, and 1 minute of this intensity of activity will result in 2 heart points. And if you don't have any of those things and you just want to enter your workout session after the fact, let's say you went for a swim, you didn't have a watch or phone on you, you can enter a session manually, and the app will use MET tables to figure out what the appropriate heart points are for this activity. So really, this is an overview of the physical activity guidelines, the importance of physical activity, and a way to frame this for your clients so that they can think about the health benefits of physical activity and not just the performance aspect or things like that. I'm going to transition over now to Tristan, who's going to take over and talk more about the practical applications of heart points from an EXOS perspective. Thank you for your attention, and I hope this was useful.
Hey, everybody. Doctor, thanks for passing it off, and looking forward to getting into this. My name is Tristan Rice. I'm a performance specialist with EXOS. I'm based in Phoenix, Arizona, and have been with the company since about 2008. What I want to do now is sort of pick up the story where Doc left off and start to talk about some practical sort of application. I think there won't be very much disagreement about whether or not it's important for clients to exercise. I don't think there will be very much disagreement that there needs to be a way to quantify it. Really, I think what I want to do is spend some time talking about the way that we at EXOS organize these cardiovascular training programs and introduce that system, which we call energy systems development. And so if we take a look again back at the presentation, right, if I can draw that back up here, right, really where we want to pick up is start to think about the practical application of this, right? How do we go and actually put this together in a way that is going to make sense for not only your clients, in terms of their ability to engage with the program, their willingness to increase adherence and be consistent with the program, but also, give you a bit of tools as the trainer, right, as the subject matter expert, to be able to go and actually put this to use in a way which is effective, in a way which is efficient, right, hitting the most appropriate heart points goals for them along the way. And so really what we want to talk about here are, review just very quickly heart points for your clients, give a brief overview of what we call energy systems development, and then how do we actually use that to design programs with heart points so that we're able to help clients hit their targets and hit their goals. Because remember, if we think about heart points and using heart points for clients, there are different ways that we can go and track those, right? We can either do that manually or with some sort of external device. Manually could be using a MET table, right, to estimate the metabolic equivalent of the work that they had done, where 1 heart point would be given for an activity which has a MET equivalent of 3 to 6, whereas anything that has a MET equivalent of greater than 6, you would get 2 heart points, right? And then within the app, it's important to remember that the intensity slider can help to increase the accuracy of the calculation when you are adding things manually. But then, we think not only are you able to add activity manually, but you can also do this with an external device, something like an activity tracker, a heart rate monitor, something that's paying attention to how many steps you take. Your phone, even in a lot of cases, can serve this function as well. And the way that those work is by using an accelerometer, right? And the accelerometer in that device is going to give an estimation of, it might give an estimation of speed, but it's certainly going to give an estimation of steps, right? And so when we look at steps, how many times your foot contacts the ground, right? If you are 100 to 129 steps per minute, that would be the equivalent of 1 heart point, whereas greater than 130 steps per minute then would be would get 2 heart points. And then if you look at heart rate, right, 50 to 69% of estimated heart rate max would get you 1 heart point, and greater than 70% of estimated heart rate max would get you 2 heart points. All this to say, that there are different ways that we can track this, right? There are different measures that we can use, and we'll talk in a minute about how we would go and marry this to individuals, how we would go and consider the fitness level of the clients that you're working with, specifically when it comes to building programming, either individual cardiovascular training sessions or more broadly, cardiovascular training programs. But in either case, the point here is that, there are different options that we have. And as you move from a manual entry to an external device, the accuracy of the data that you're going to be able to offer is going to increase. And if it doesn't cost anything in terms of effort, or if the cost is minimal in terms of effort, then really it improves the experience overall because it more accurately tracks the work that your clients are doing. And so when we look at the target of 150 minutes per week of moderate to vigorous physical activity, I think, what does that actually mean? And there's different ways, of course, that we can do that, considering that, at a certain step frequency, at a certain heart rate, at a certain metabolic equivalent, you would get 1 or 2 heart points. If the goal is 150 per week, what that means is that there's different ways that you could get there. There's going to be lots of different ways that you could build 150 points across any given week. So when we think about this, you could look at vigorous intensity, those higher speed, higher intensity sessions, and only getting 75 minutes of those per week. That would get you 150 points at 2 points per minute there. Whereas you could also go for 150 minutes of moderate intensity, keeping in mind that 100 to 129 steps per minute, those more moderate heart rate intensities, those more moderate metabolic equivalents of 3 to 6, are going to get you 1 point per minute, right? And so you have these black and white kind of options, right? 75 minutes of vigorous intensity at 2 points per minute, or 150 minutes of moderate intensity, for 150 points, right? But more than likely, what's going to end up happening is that there's going to be some combination of the two. And so, the question really becomes, well, how do we actually go and put this together in a meaningful way? 75 minutes of vigorous intensity, 150 minutes of moderate intensity, would certainly be appropriate for some of your clients. Those who are more deconditioned, those who may be coming back from being sedentary, those who otherwise need a more sort of dialed down program for one reason or another, they may thrive in these sorts of environments. But, when you sort of get beyond that block of clients that you'll be working with, really, I think where the magic can happen is in the combination and the way that you put this together across the week. And so this is really where energy systems development comes in. And energy systems development is really just the fancy term that we use for cardio. The reason being that cardio sort of has this connotation. It sort of has this associated meaning with it, where it's generally a term that's associated with the traditional approach to cardiovascular conditioning. This is, when I go say that I'm going to go do cardio, if I were to go to the gym and do some cardio, if I were to go for a hike in the mountains here around Phoenix to get some cardio, the sort of the idea that comes up is that, you kind of just you just sort of get set up and you just sort of plod along and you just kind of kill time. This is like your velour tracksuit. This is like your People magazine set up on the elliptical, and you kind of just cruise until you're done. And that certainly is going to be effective for some people. For those clients who are deconditioned, for those who are out of shape for one reason or another, they may be sedentary, they may be coming back from injury, there may be some medically supervised cardiac rehab or something like this, that may actually be the best choice for that individual. However, if you look at the population at large that you might be working with in the training environment, and you really quickly start to see some issues with that. We know that generally adherence to cardiovascular, quote unquote, cardiovascular training programs is at 6 months. Adherence to cardiovascular training programs is actually somewhere around 50%. So 6 months into a training plan, half of the people who initially engaged in that plan have fallen off. And think back to the beginning of the year. Think back to the beginning of any year, right? How busy is the gym in January, in February? But then does it start to taper off, right? Towards the end of February and certainly into March and April. How many people make New Year's resolutions to be healthier, to be more fit, to exercise more, and are gung-ho and are super consistent for a couple of weeks, but then start to trickle off? And so really, what we want to do for a variety of reasons is give the opportunity to have some variability, give the opportunity to have some variation in the session so that you might repeat a block of sessions for a certain number of weeks, just like you would in the weight room, right, with a strength training plan, but that there's always going to be a bit of something different so that no 2 days end up being completely identical, exactly the same, down to every single detail. And what research has found is that adherence to interval-based cardiovascular training programs is actually significantly higher. That they tend to be much more engaging from a client's perspective, and they tend to be much more in addition to that, they tend to be much more well-rounded in terms of the benefits that they offer, right? And so when we look at training for performance, when we look at training for moderate to high levels of fitness, what we really want to do is as opposed to just having somebody do a cardio training plan, we want to offer something more that gives them variation, that gives them something that's going to be much more engaging. And that's really where energy systems development comes in, because ESD, you'll hear me call energy systems development ESD if you haven't already. ESD is targeted to the individual's needs and demands. Each session is tailored to elicit a specific training response and therefore develop the metabolic infrastructure required to achieve individual goals. And so where we have, on the one hand, just cardio with a dropout rate of 50% at 6 months. On the other hand, we have a system to organize cardiovascular training sessions of various intensities for various durations. And that's really all energy systems development, or ESD, is. ESD is just a system to organize your thoughts. Because very quickly when it comes to talking about ESD, very quickly it becomes this sort of nebulous sort of netherworld of talking about, ATP bioenergetics, and how it's synthesized, how it's applied, where's the reuptake, what happens to your 2 glycogen, or what happens to the 2 ATP that you get from a glycogen from a fast glycolytic pathway versus the 36 that you get from a slow glycolytic pathway. And we sort of, it gets very confusing very quickly. And I think there's a big conversation to be had about that. But the general thought that we have is that isn't necessarily helpful to have the language about cardiovascular training be so heavily rooted in physiology, for a lot of reasons that we don't necessarily have time to go into in detail today. But really the upshot is that what we try to do is use systems to organize ESD training plans, which are familiar to us. I feel very comfortable talking about sets and reps. I feel very comfortable talking about percentages of intensity when it comes to strength training. And so the idea here is, how do we use those systems, and how do we use that language specific to cardiovascular training, specific to ESD, so that we can then feel much more comfortable and confident exposing to various sessions with varied intensity for varied durations, so that we then are able to develop the metabolic infrastructure that's required for our clients to achieve their individual goals. And the first part of that conversation really comes around intensity. How do we track intensity? There have been lots of, and if you've been paying attention, you've noticed that there have been lots of systems offered to be able to track intensity here. We can look at your percent heart rate of estimated max. We can look at the steps per minute. We can look at the metabolic equivalents. We can also look at rate of perceived exertion. Rate of perceived exertion is a scale of 1 to 10, 1 being the easiest thing that you've ever done, basically asleep, and 10 being something that there's no chance that you could carry on for very much longer whatsoever. It's the hardest effort that you've ever given. And so this sliding scale of the easiest thing ever to the hardest thing ever gives us opportunity to calibrate the intensity that our clients are working at. And rate of perceived exertion is something that they offer based on how hard they feel like they perceive that they're working, right? And so the thing about rate of perceived exertion is that it ends up actually being incredibly accurate. Initially, there's lots of gaps. Initially, it takes some practice. It takes some getting used to work with, figuring out how hard it is that you're actually working. But with 2 weeks of consistent practice, rate of perceived exertion can be an incredibly accurate measure of intensity, both in the moment and then of the overall training session once it's been completed. And so we look at these targets, of light, moderate, and vigorous intensity when we're tracking moderate to vigorous physical activity, 150 points per week. And here we're able to sort of bring these varied systems together, right? A light intensity would be a rate of perceived exertion of a 3 to 5 out of 10. You can appreciate that that's a relatively low intensity. That's a very low intensity. That would be a light effort. Whereas a moderate intensity would be something that's more of a 6 to 7 out of 10. That would be something which would be flirting with, slightly beyond, slightly below your anaerobic threshold, your lactate threshold, your ventilatory threshold. This is where that moderate zone, that's where this is where talking is going to start to become an issue. This is where, you need to sort of remove focus from external barriers and just sort of live and be present in the moment. And then a vigorous intensity would be 8 to 9 out of 10, right? And we have heart points associated with each, and we have percentages of heart rate max associated with each. And so now you can really decide what's going to be the best means for your clients. Are they entering their activity manually? Are they using some type of tracking device? But in either case, these are the sort of parameters that we use so that when we then go and look at individual training sessions, we can now use these parameters to build training sessions. Here, it's offered in rate of perceived exertion, but it could just as easily be metabolic equivalents. It could just as easily be steps per minute. It could just as easily be percent of heart rate, right? Based on the way that you understand tracking and programming intensity in your ESD sessions, we could use those different variables to a certain extent interchangeably here, right? And so for a light intensity session, for example, that would just be something that you just go out and do. 15 to 20 minutes is here what's offered. Understanding that, that could be something that you go for. You could build up maybe up to 30 minutes, 45, 60 minutes, etc. You get higher fit individuals, those who are, intermediate to high fitness levels, they might be going up for several hours if they're going out for bike rides on the weekend, right? But in either case, the light intensity session is just that, right? A casual walk or bike ride to get your body moving. These days are incredibly important, specifically for recovery, right? They help. Here we have all types of associated benefits in terms of brain health and cognitive function. Here we have all types of associated benefits at the ability of the body to clear byproducts generally, right? Light intensity sessions are incredibly helpful. And so, and all that to say that even though you're going to accumulate the lowest number of heart points here, they're not something that should just be neglected. Now, if you think about the structure of a week of training with a client, this might not be the best use of your time with them in the gym. Again, if you have those who are low fit, if you have those who have historically been sedentary, this might be where you really want to sort of buckle down and spend some time. But if you have those who are intermediate to high fitness, you might want to focus more on higher intensity sessions because that's what they need, but also because it's more time efficient. And so for those individuals, these light intensity sessions might be things that you ask them to do on their own. For example, here in Phoenix, we have 300 days of sunshine a year. It gets quite hot in the summer, but it's still not bad weather. And so, it's pretty easy for us on a light intensity ESD day to sort of just point to one of the mountains that surround the valley and just say, yeah, go walk to the top of that mountain and take a selfie to prove to me that you were there. Right? It gives them the opportunity to get out to sort of, there's all sorts of psychological unloads and these sorts of things that happen there as well. And so in either case, light intensity sessions, you just go at a low intensity and you're moving your body, casual walk or bike ride. Split that up now. Now we get into the moderate intensity sessions. And these are really where we start to get into intervals. And this is just a sample here, right? Where we might have a block of warm up. Maybe it's a 5-minute warm up or so with a 2-minute walk afterwards to kind of get blood into the right place, to kind of get moving before we get into the work. And then we would alternate periods of high and low intensity, right? This could be speeding up your walk, right, to a 6 or a 7 RPE out of 10, but then resting again at 3 to 5. That doesn't mean stopping. That is an active recovery, and then repeating that 5 times, right? So you can imagine then if you have 2 minutes of work, 2 minutes of rest, right? That's 4 minutes for that whole set, right? And then if we have 5 of those at 4 minutes apiece, that then is going to be 20 total minutes of work, right? And your heart rate, if you're tracking with heart rate, your heart rate's going to fluctuate. It's going to rise when you go to the 6 to 7. It's going to drop when you go to the 3 to 5. If you're tracking your activity with some type of device, specifically if you're looking at heart rate, you're going to be getting heart points. You're going to be accumulating heart points, in some cases well into your recovery period, because it's going to take some time for your heart rate to drop back down into that recovery zone, right? And so in either case, the moderate intensity sessions, we have exposure to higher intensity, in this case represented by rate of perceived exertion, alternated with periods of lower intensity, again here represented by rate of perceived exertion, with both a warm-up and a cool-down afterwards. Warm-up to really sort of get blood in the places that it needs to go, and cool-down to just sort of ease the transition back into a resting sort of state. Then when we look at a vigorous intensity session, here you're going to get the most heart points in terms of the effort that you're working. And now what I want you to notice here is 2 things. Three things. Number one, the warm-up and cool-down structure still exists, right? We still need to get blood into the right places. We still need to have a bit of a cool down to ease the transition back into rest. But 2 things happen specifically within that block, right? Number one, the rate of perceived exertion for the work increases. Instead of a 6 to 7, now we're going to go 7 to 8 out of 10. That's going to put us into the vigorous intensity zone. And number 2, in order to accommodate that higher intensity, the duration of the effort decreases, right? Because you're working at higher intensity, you're not going to be able to maintain that for quite as long. So where it was before a 6 to 7 RPE for 2 minutes, now because we've increased the intensity that you're working at, and this could go 8 to 9 or even 9 to 10 for those who are really in good shape, because you've increased the intensity that you're asking for, you're not going to be able to express that intensity for the same amount of time. For example, you run a 5K faster than you would run a 10K. You wouldn't run your 10K at your 5K pace. It's just too fast. It's just too long, right? And so you naturally sort of calibrate. And so here we still have this same sort of structure, right? High intensity, increased intensity, lower intensity for recovery. Here, the structure changes in terms of the intensity that we're looking for, the duration of the on effort. The recovery still exists here. So now we have 30 seconds on, 90 seconds off. That's 2 minutes for each effort, 5 reps of that. That then gets you 10 minutes of work. And so when you have these individuals who are intermediate fitness level, high fitness level, right? This is going to end up being a much more time efficient way to program your energy systems development, your cardiovascular training, because you're not just sort of pointing them at the bike and asking them to go for 20 to 30 minutes. There are those that you work with, I'm sure, for whom that would be the most appropriate and in fact the best thing to do. But when somebody crosses a threshold from a low into an intermediate fitness level, now we want to start to add in some variety. Now we want to start to add in some variability. Here, if this is with a 5-minute warm-up and a 5-minute cool down, this is 20 minutes, right? You're not asking a whole lot in terms of time. And so if you have a 45 or a 60-minute session with somebody, this is something which is incredibly reasonable to fit within that time frame. If you had somebody for a shorter period of time, a 30-minute session, say, right, then what we could do is keep the cool down, but assume that you've already got a whole bunch of warm-ups. So maybe we cut that from 5 minutes down to 2 or 3 minutes, right? Now that 20-minute session ends up being 17 or 18 minutes. Cut down the number of reps here or the amount of time that you're resting, and you can condense the time even further. But in either case, we have these different ways of tracking intensity. We can put them together in different combinations here of work and rest to be able to make light versus moderate versus vigorous intensity sessions, as the doc was talking about with regards to heart points. And putting these together across the week now gives us the opportunity to target that 150 number. Now we can think about how are we going to build 150? And this is just the standard programmatic template that we use when it comes to when it comes to designing ESD training sessions. We'll start the training week off with a moderate intensity session, then progress to a vigorous intensity session, right? We understand that some fatigue is accumulated, so then we'll come back with a light intensity session to stimulate a bit of recovery, an active sort of recovery. And then that 3-day block will repeat through the second half of the week. So Thursday is going to be moderate, just like Monday. Friday would be vigorous, just like Tuesday. Saturday would be light, just like Wednesday. And so here we have exposure to different types of sessions. Here, there's variability. This is going to increase engagement. Increased engagement is going to increase adherence. Here, we still also notice protect a day off, right? There still is a day without physical activity, which when you get 6 days of exercise, that could end up being quite a lot. That could take quite a toll, especially if you were to do 7 days of exercise for a consecutive number of weeks. You would no days off, right? You're just dropping straw onto the back of the camel. At some point, there's going to be one that's too much. And so really here, we build in 2 moderate and 2 vigorous sessions. This allows us the opportunity to build towards that 150 heart point goal. We build in 2 light intensity sessions or 2 lighter sessions. This facilitates a bit of recovery. And then we also maintain that off day, right? So that we're able to really make sure that we get a bit of, we get a genuine sort of recovery throughout. Now, this is, I know that a 6-day training schedule in personal training really isn't super realistic, right? And so we think about, well, how do we prioritize this with those individuals who come into us 2 or 3 times a week? And here, the logic that we take here is that we prioritize the higher intensity sessions, vigorous intensity sessions, before we target the moderate intensity sessions. And only if you come in 3 consecutive days would we give you a light intensity session. And so we're looking for at least 1 vigorous and at least 1 moderate session per week, right? But if you come in 3 consecutive days, then we would give you that light intensity session to facilitate a bit of recovery, right? And so this is the standard sort of template, and it's not going to be right for everybody. For somebody who is deconditioned, for somebody who is sedentary, for somebody who's coming back from some type of injury or procedure, this is likely going to be way too much. And so we think about how, and so we'll talk in a moment about how we calibrate this to an individual. Just keep in mind, this is an example here at this moment of how we take these individual sessions and build them towards a target week where we can look at getting and accumulating 150 heart points per week. Because then we look at what these sessions could be. Here are 2 light intensity, 2 moderate intensity, 2 vigorous intensity sessions, and there's all different sorts of combinations here, right? Depending on the amount of time that you have with your clients, depending on the goals that you have, depending on the goals that they have for themselves, depending on the facility that you have, what type of equipment do you have available? What sort of space do they have available to exercise on their own or at home? We can use these factors to then determine how do we go and actually build the sessions, right? Notice here, beneath the moderate and vigorous intensity interval blocks, it says repeat by 5 to 6, repeat by 4 to 5, right? Because what this is meant to offer is the ability to toggle and to calibrate based on time. If you've got less time, then you would do less of these repeat blocks of intervals. If you've got more time, you could do more of these repeat blocks of intervals. Understanding that in an ESD programmatic standpoint, or from an ESD programmatic standpoint, generally what we're looking at is that moderate intensity sessions will last somewhere between 10 to 20 minutes. That includes your work and your rest, not necessarily your warm up and your cool down. And that vigorous intensity sessions would last somewhere between 5 and 12 minutes. And again, that would include your work and your rest, not necessarily your warm up and your cool downs, right? And so here are examples of how sample sessions that you can then work through and use these to build towards your clients accumulating that 150 heart points per week. So now we think about now that we talked about these general sort of structure of ESD, given examples of light versus moderate versus vigorous intensity sessions, and offered a bit of a template week for how to put that together to help get to 150 points. Now we need to think about bringing this home and calibrate that to the individuals that you work with, because everybody's going to come with their own sort of set of parameters, right? What's their current fitness regimen? How often are they training with you versus how often are they training on their own, right? What are they doing on their own when they're not with you? What would you like them to be doing on their own that they are currently missing or that they're not doing? Are they missing that light intensity, those light intensity type sessions? You can think about not only what are they currently doing, but what is their current fitness level, right? Because the fitness level of your client will determine not only their total heart points goal for the week, but also your recommendations for movement and the balance of intensity throughout the week. For example, a sedentary person is going to need something that's very different to somebody who's training for a triathlon, somebody who's training for a marathon, somebody who's training for CrossFit Games, and something like this, right? That these different classifications of folks are going to need different types of things. And so here are sample weeks based on the types of individuals that you may be seeing, right? For somebody who is low fitness, we would want to be really gentle with those individuals. Light intensity day, moderate intensity day, and then a day off, and then repeat that through the second half of the week. Here we want to encourage them to come back. Here we want to encourage them to be more consistent. Here we want to put them in a position to be successful. Moderate fitness level, then same intent, same target, right? We want to encourage them to, or we want to put them in a position to be successful. But now we start to introduce those vigorous intensity sessions, versus the high fitness level might get that standard template that we talked about before. And there's a whole conversation to be had of what is low fitness, moderate fitness, high fitness that we could spend hours talking about. But at this moment, I think we all have an understanding of what the fitness level of our clients is or are, and that we can use this as a standard to start to calibrate the ESD sessions that we're offering, so that we're able to get them the heart points that they need to be able to hit their targets, and then increase their health and wellness because of the exercise plans that they're doing with you. And so now here are 4 slides that really are meant to show a periodization of ESD training sessions. Here, specifically call your attention, this is moderate intensity. This would be like a couch to 5K. This is somebody who's just coming up and just getting going and needs to sort of build some capacity and get back into a routine. Here across this table, you have work interval in minutes, rest interval in minutes, the number of times that you would repeat that, the total time for the work, right? Just the work exclusively versus the total time for the session. And here what we do is we go 2 to 2 work to rest. That's a 1-to-1 work to rest ratio. 2 minutes on, 2 minutes off, 5 times for 20 total minutes. Then we go a 2 minutes on, 1 minute off, 6 times. Notice that the work has increased, but the total time in the session has decreased. We're increasing capacity. And as you walk your way down here, what you can see is that by the time that you get to the bottom of 4 minutes on, 1 minute off for 4 reps, here the time that you're working is actually the highest, but the time in the session is the same to what it was in the first. And so this ends up being a progression where we're biasing capacity. If I want to improve your ability to exercise and move, I need to reduce the amount of time in the session that you're that you're resting. And so when I go from a 2 minutes on, 2 minutes off, that's a 1-to-1 work to rest ratio, progress all the way down, 4 minutes on, 1 minute off. That's a 4-to-1 work to rest ratio. Right now, you can see that you are significantly increasing the amount of time that you're working within that session. And because you're significantly increasing the amount of time that you're working in that session, you're going to improve the ability of that individual to be able to work for longer. You're going to improve their capacity. Here, example for moderate intensity sessions. Here, same structure, same exact story, in fact. Now we're talking seconds instead of minutes for vigorous intensity. And so when we look at a low or a moderate fitness program, even when we look at a high fitness program, right, we might start by working from the top down to the bottom. And so you might have a situation where the moderate intensity session was Monday, and one of these sessions might be Tuesday. And then you might repeat that through the back half of the week, Thursday and Friday. And you might have a situation where 8 seconds of work, 52 seconds of rest, 8 reps for a total ESD session time of 8 minutes, right? You might repeat that for a period of 2 to 3 weeks to give them opportunity to be able to adapt, so that you then are able to ensure that they're getting a satisfactory saturation of that stimulus, but not so long that it then ends up getting stale. And so here, initially, the same story is true. 8 seconds on, 52 seconds off to begin, toggle all the way down to the bottom, 12 seconds on, 48 seconds off at the end. We are increasing the density. And so you're increasing the amount of time that they're working in the session. So you're increasing their capacity, their ability to work for a period of time. Once they've been through this, though, now you don't just want to get them couch to 5K. They crossed that finish line. They got that medal. Now what do we want to think about when it comes time to PR your 5K? Well, we can use exactly the same structure. We can use exactly these same sessions, but now instead of working our way top to bottom, where we increase the density of the session to increase capacity from a cardiovascular fitness standpoint, now we can turn that around and focus on performance. And performance would be less about what is the density of the ESD training session and more about what is the intensity that you're working at. How fast are you running when it's time to run? How hard are you pushing when it's time to push? And so in that case, we look at a 4 minutes on, 1 minute off structure, very bottom. And if you have 4 minutes of work paired with only 1 minute of rest, and you're trying to work at the highest possible intensity, if you're trying to run as fast as possible, at 4 minutes of work, 1 minute of rest, you're not going to be running as fast as you would in a situation where you have 2 minutes of work and 2 minutes of rest. Because in one situation, you have a quarter of the time that you're working to rest, 4 minutes on, 1 minute off. Whereas in another situation, you have equal time of work and rest. And so when the density decreases, if we're focusing on intensity, how hard you're pushing, we actually want to start from the bottom and work our way up. That wouldn't be appropriate for somebody who is a low fitness level, but for somebody who is a moderate or a high fitness level, this might be just the thing that they need because now they're able to go and push much harder. Same story is true for the vigorous intensity sessions as well. As we go from 12 seconds of work, 48 seconds of rest, that is a 1 to 4 work to rest ratio, right? Now we can go 8 seconds of work, 52 seconds of rest, right? That is a 1 to, what would that be? 5.5 work to rest ratio, 6.5 work to rest ratio, right? And so now we have much more time to rest, 8 seconds on, 52 seconds off, than we did before 12 seconds on, 48 seconds off. And so if the target is to push as hard as possible, then you're going to go and get a much higher intensity on that 8 seconds on, 52 seconds off than you do on the 12 seconds on, 48 seconds off. And so the first step we would buy is capacity. Start from the top and work your way down. It might be 1 to 2 weeks at each level, built along that weekly timetable. But then eventually we could turn that around and go from the bottom and work our way up. And when we do this, what this then does is it adds variability, it adds variety to the training sessions. It gives your clients something to look forward to, and it can increase engagement. And so this, not only are you putting them in a situation, in a position to be successful in terms of meeting their hard points, but you're also putting them in a position to be successful in terms of consistency with the plan. So I hope that this was helpful. I hope that this was, there was some information in here that you found valuable. Please do let us know if there are any questions that you have. Thank you very much for your time. I appreciate it very much. Bye.
Thank you again for attending, and a special thank you to Tristan Rice, Dr. Kapil Parakh, EXOS, and Google Fit for supporting this webinar. As a final reminder, please complete the short survey and the 15-question self-test. Upon passing the self-test, you will receive your CEC certificate via email, and your CEC will automatically be added to your ACSM profile. This concludes the webinar.